Hello and welcome to our broker selling series, Growing by Referral. My name is Erin Ackenheil and I'm so glad to be here with you today to share some really good information about growing your referral-based business. A lot of people like to talk about it. People don't really want to be having to spend hundreds of thousands of dollars into a marketing campaign. And growing by referral is an inexpensive but time-consuming way to grow, because you really have to do a good job with existing clients and out in the community to really truly build a referral-based business. So I'm happy to share some of my tips of the trade. Some of them will probably be things you're already familiar with and comfortable with. Others might be something brand new. Now, if you're watching via live stream on LinkedIn or Facebook, you can put comments or questions or throw me a hello or anything you like to show me that you can hear me live, and certainly ask a question, and I'm happy to answer that throughout the training here today. So let's go ahead and get started. My name is Erin Ackenheil. I own Blackpoint Insurance. At Blackpoint, we help Medicare beneficiaries learn about the A, B, C's, and D's of Medicare, help them make plan choices for Medicare supplements, Medicare Advantage, and Part D prescription drug plans. We also help agents and brokers nationwide learn to launch, grow, and retain their businesses. And so this is part of our broker training series, just helping to share what we know for those of you out there who are looking to grow and knowing you're not in it alone. We're here to help you along the way. So let's get started. Let's hopefully get started. Here we go. So we have a full agenda today. The beginning part is just going to be a little Blackpoint commercial. A lot of you are out there trying to grow your businesses. Some are doing it independently. Some might be working with other upline partners. And Blackpoint is one of those arrangements that you can work with to help you launch and grow your Medicare business. So I'm going to do a little commercial to tell you a little bit about us and what we do. Hello there. I see people coming in, 100%. A few good mornings. Hello, everybody. So we'll jump in and get started. Then we're going to talk about a high-touch sales cycle. Really, the best source of referrals is going to be your existing clients. And the only way that I know of to get your clients to refer more people, friends, and family, and to trust you is a really high touch model. You're doing a good job for them consistently, and it really does lead to referrals. So it's back to basics. It's things that you know, but there might be a few new tidbits in there that you can add to your bag of tricks, so to speak. Then we're going to talk about key contacts in the community, providers, local area marketing, other sources of influence that can really build to your referral base. So you're not having to necessarily rely on traditional marketing, direct mail, newspaper, and other expensive mechanisms. So let's jump in. And certainly if you have a question, don't hesitate to put it in the chat box. It'll come up and I'll try to incorporate the information. So first off, the Blackpoint commercial. Again, my name is Erin Ackenheil. I've been in the Medicare business for 30 years. If you can believe it, pretty much my whole adult life, I've been working in the Medicare business. And originally my background was on the carrier side. So I know a lot of people who look to get into the Medicare space as a broker, they actually come from the carrier side as well. And it can be difficult to know, how do I grow my business? How do I get started? What are my first steps? How do I get the support I need to be able to grow more? And so I'm kind of showing this to you a little bit bigger here. But a great way to do that in the Medicare space is to work with an upline partner. And so how it works is, imagine there's a big field marketing organization. Ours is Van Berg and Associates, that works with direct contracts with all these insurance companies. So all of these are partnering with Van Berg. They're under contract under an FMO agreement. And Van Berg is a fantastic partner. So I had my share of requests when I first started in the business, but I wanted to find a partner who I could trust, that was vested in seniors just like I was, that was good about making sure that I got 100% of my commissions and that I retained 100% of my block of business and things like this. It's really important to me to protect my clients and also to protect myself as I was growing a long-term sustainable business. And I found that partner in Van Berg. They don't play games or try to tie me to their contract or anything like that. And what they provide is a really great back-end office support for me. So they have a system called Agent Pit Stop that tracks all of my enrollments. So I have one-stop shopping to see everything that's going on with my clients. They help with contracting. So if I want to contract with various carriers, I request a contract. They help me with that back end paperwork to get me launched and started. They help with marketing. So on their agent pit stop tool, they have a whole library of materials you can choose from all different situations that might happen, open enrollment or agents or product terminations or anything like this where you're trying to market in your community. They have a whole library available of materials that you can customize, get sent to local printer, get printed on your behalf or mailed. So a very good system to work with. They handle app processing. So a lot of our enrollments these days finally are done online. But when there's paper applications, they help with the processing. They also help on the back end, like, hey, something's missing on this client's application or the Medicare number was invalid, that kind of thing, providing that level of support. Then comes in Blackpoint. So what I'm considered is a GA, a general agency, and I contract as essentially a manager under this Blackpoint umbrella, or under this Vanberg umbrella. So Blackpoint provides a lot of local area marketing support. We're going to help you strategize and business plan. We're going to give you additional training. Today would be an example of that, but certainly not limited. We have a CRM tool called Salesforce that's designed for Medicare agents that we can help with, support, train, and provide that service, and just really helping you to strategize to build your book of business. So that local support, you have a question, you just don't understand how it applies to your beneficiary situation, you can reach out to us and get more help. So it's a great situation. You keep your commissions, you get marketing support, you get contracting support. You basically have the benefit of a back office team helping you with every step of the way without having to really give anything up. So it's really a win-win to help you grow your business. So I encourage you, especially if you're new and trying to find a home, check us out and see if we can help you grow, see if we can be mutually beneficial partners. I'd be happy to work with you. So now, commercial over, let's jump into the information. So probably the number one way that I know of to gain referrals is to have happy clients, happy, satisfied clients that want to help you grow your business. What I find is I actually build a strong friendship with the majority of my clients. I try to attract that. I want people who want to work together, who know that I have their best interests at heart and helping them to really make sure that their healthcare is 100% taken care of. And they feel that sincerity and they want to refer friends and family to me to help them grow. And so what I think is the number one tactic, sounds tried but true, is a happy client. They're going to bring you more referrals. So in order to do that, we've implemented here a high touch sales model. And our Salesforce tool is designed to reflect that. So the sales model essentially is the client at the center of everything that you do. And obviously it doesn't always work like a perfect science, getting everything in order. But the first thing that we like to do at Blackpoint is to make sure every single person attends a Medicare 101. This is really important. We do these live. And really, not only are you educating on the A, B, C's, and D's of Medicare and the next steps in the process, but this is really your opportunity to say, why you? Why you over the dozens and dozens of people who could offer them Medicare plans and assist them? What makes you special? What makes you unique? Why do you care just a little bit more than everybody else? And this is that beginning of that friendship. So you're nurturing that relationship and providing really important information, but also creating a bond that makes them want to buy with you in the long run. So Medicare 101, clearly this is the sales cycle when you're getting people when they're new to the game. But you could replace this with AEP 101. Just providing that education step is important to build that relationship. And they know you're doing this just to help them. It's not for what's just in it for you. It's to help them, to educate them so they're making good decisions. The second step in the process, now a lot of people think, oh gosh, so many steps, like I just want to sign them up. And it's tempting to do that, but the steps matter. And so a pre-assessment in the perfect world is essentially a one-on-one phone call where you review their current situation and outline next steps. Oh, you're still working. That employer coverage is not going to be considered primary. You need to go ahead and take your Medicare. Let's outline your next steps. Or you're still working and that coverage is good for you in your situation. You have the opportunity to wait. Let's build something for down the road when you become a late retiree. Half the time, the business that you walk away from becomes your strongest referrers, right? So if you're saying, hey, I'll help you down the road, but it's more appropriate for you to stay in your current situation, Nothing fosters referrals like that fresh honesty of what's best for your particular client and their current situation. And then, of course, you're outlining next steps. Now, the next steps are going to vary based on the client that you're with. So the next step could be you need to take Medicare, and then you're ahead of that buying process, particularly on an agent, and you're booking that follow-up appointment about 4 weeks after they've received their Medicare card. So after they've applied, 4 weeks later, you're setting up that next step. Maybe that's a plan review and enrollment meeting in their home, or maybe that's something virtual through the Zoom or some other mechanism. But you're really setting up that benefits discussion for a face-to-face conversation. Also, the next step could be, I'm a late retiree, so I'm going to contact you once a year in January just to check in and help you understand about enrolling within 8 months of leaving your employer coverage and keeping a paper trail of that employer coverage. So you're always checking in and keeping a good tickler system in place on your system so that those leads stay fresh. Because you can do a great job on a Medicare 101, but if somebody doesn't retire for 4 more years and they've got qualified employer coverage, if you haven't frequently been touching those leads, then they're going to forget about you. They're going to not remember that you did a great job with them at the beginning, and they may find someone else. So a high touch model really sets the stage to gain those enrollments, but also sets the stage to get sales down the road. And then finally, the enrollment process. So completing the enrollment paperwork, explaining what's going to happen in the post-enrollment process, giving them bonus features. So if you've signed up somebody and they have a vision and a hearing and a dental benefit, providing a follow-up message that gives them that information of how to access those benefits so they're not having to find that in the myriad of materials that they receive. High touch model sets the stage for retention. They know that you care and you've invested the time in them to make sure they have the best possible experience with their health plan. Now, I just want to remind you, we are live. If you have a question, you can send it over and it'll pop up on my screen. If you haven't said hello and you're watching live, be sure to give me a hello so I know you're out there. Give me a thumbs up, whatever you like to do. Now let's talk about our follow-up. So once you've done this great sales process, you can't forget about them. A lot of people, brokers even that I've spoken to, they want a push versus pull. And at Black Point Insurance, we recommend a pull. You're constantly talking to them. You're constantly touching them. You're constantly trying to create a relationship to help you grow your business. And that starts with a thank you note. We do handwritten thank you notes. Believe it. It's old school. It takes just a couple of minutes, but a handwritten thank you note is a nice touch. Give them your business card. You don't necessarily have to ask for referrals there. It just becomes implied. Thank you. I'm always looking to grow my business. If you need any assistance or any of your family and friends, always contact me. Thank you so much for working with me. Another big step is confirming the enrollment. A big step that people forget is, hey, your application went through. Here's your new member ID card. If you have any questions, please let me know. Or here's your ID number. Your card is coming. Confirm that enrollment. Let them know the next step. Maybe you need to cancel your old insurance. Maybe it's an automatic transfer. So always outlining those next steps for them is super, super important. Now at Black Point, we actually have all these in templates in our CRM tool. So those are things that you can take advantage of to say, hey, I've got these ready to go. I've got this enrollment confirmed. Here's your new member ID number and you're on your way. And then of course from there, don't miss the opportunity to have a high touch on easy things. Happy birthday, a birthday card. Some people do a birthday email. I recommend a birthday card. A lot of people who you work with, some have a really strong network of people who care about them and are sending them birthday cards and spending time with them. Some don't. This might be the only birthday card they get that year. So just having that connection is a super big deal with your clients. Happy holidays, whatever you like to celebrate. We're busy during AEP, not much time for a Thanksgiving card, maybe not even time for a card in time for other holidays in December, but maybe it's a New Year's card, or maybe it's a grateful card, or an end of the year card, or happy holidays. Whatever you celebrate, it doesn't matter. It's just an opportunity to have a touch point, and you want to be saying hello and just letting them know that you care. As we all know, there's an enrollment period that happens called OEP from January 1st through March 31st each year for people who are on Advantage plans. they're in there, that's an opportunity, a one-time chance to change between Advantage plans or go back to original Medicare. That's a vulnerable time for your clients. It's not a time to go out aggressively marketing to new people because that's not compliant, but it is a time to check base with your existing clients. Hey, how's everything going? Have you had an opportunity to experience the plan this year? Any questions at all? Have you taken advantage of the vision plan or the dental plan or a special discount or the gym membership? Whatever is something that you maybe want to emphasize for your clients, you want to connect with them at that point. 99% of them are going to say, I'm pretty happy with the plan choice that you gave me. And it's just another touch point that shows you're interested in growing business and that you care about them and their situation. For the 1% or couple percent that need to make a change or have a question, then you're assisting them and you're addressing that and you're solidifying that relationship so that they stay with you down the road. These members are vulnerable to leave for another agent or another health plan or carrier. And so that high touch not only retains them, but gives you another opportunity to grow referrals. Now, AEP is a really important time. That's the period that we're approaching from October 15th to December 7th. That's the opportunity for beneficiaries to add or change prescription drug coverage or add or change Medicare Advantage plan. It's an extremely vulnerable time. They're getting mailers from 100 sources. They're hearing it on TV and radio. You want to protect your block of business and leverage the opportunity to grow by referral. So you're not becoming part of the fray with a ton of mailing or commercial or radio ads may get you some new business, but you're really just part of this big muck of Medicare marketing. And the key is getting in with your existing clients, making sure they're taken care of. And every single one of them is going to have a friend or relative that needs a checkup, a Part D checkup, or look at Advantage plan, or want something like your client has. And this is a great, tremendous opportunity to be high touch with your clients. Now, even though open enrollment doesn't begin until October 15th, your part of the deal begins a lot sooner. And so when I say be prepared, you can't give benefit information for 2023 until October 1st. That's when you can begin marketing. But nothing stops you from preparing your clients from that time period. So as early as August, that's the opportunity to do a high touch. Maybe it's a mailer combined with an email. Hey, open enrollment is coming. Just want to check in with you, see if you've had any prescription drug changes this year. Is there anything going on with your plan that you want to evaluate? Are you seeing a new doctor? Let's capture all that information in advance and assess who's really interested in making a change and wants that evaluation, and who's pretty happy if all things remain pretty much the same to stay put. You have the opportunity to assess all of this before open enrollment even begins by being in front of it and talking to your clients. It's also your opportunity to say, if friends or relatives are needing help during this time period, we know it's hectic, we know there's a lot of information, I'm here, I'm able to assist anybody along the way. Because you're talking to your clients, this is an opportunity for them to mention that to you and for you to gain referrals in that way. So you're growing, but you're also retaining and protecting your book of business. So really, really important to have a high touch model where you've identified people throughout the year who may need help, and you've reached out to get new information to see who might be vulnerable in terms of leaving the plan, and you've touched absolutely everybody and let them know they're ready to grow, that you're ready to grow and provide this service to their friends, family, neighbors, and so forth. Now, when it comes to really growing your referral base, especially when we're talking about not just your existing clients, you need to really be considering for you, your budget, your time, how many clients you do have, scripting, why you. So it always comes back to why you. You've got to have your, people will call it an elevator pitch, but it's just that 1 minute of what makes you special, because you're going to have opportunities in front of doctors' offices, medical groups, carrier partners, centers of influence. You're going to have opportunities to be in front of them, and just knowing who you are and what you do and what you provide is going to be huge for growing your referral base. When it comes to actually growing it, the first step is to identify who are the providers I want to go for. Maybe in my community, I have several medical group partners, or there's hospitals or doctor's office groups. I want to identify who I want to target with my marketing efforts. Maybe it's libraries or key centers of influences or senior centers or mobile home parks. Depending on who you are and where you are, you're going to be identifying those key centers of influence. Maybe it's Rotary groups or Elks clubs or different fraternal organizations. Identification is key. Then it's a high touch model. Just like with your clients, it's high touch. So like I said, it's not shy on investment of time, but it doesn't cost a lot of money to be in front of your target audience. But you have to put the time in, you have to calendar it, you have to be willing to commit to a high touch model for both your existing clients and all the other centers of influence that you want to work with. And then I believe it's important to have a good tracking system. It doesn't have to be fancy. It can be your community contact binder. It can be online. It can be captured within a Salesforce system, but just tracking and having a tickler system for making sure you're touching your key contacts on a consistent basis. So when we talk about key contacts equaling referrals, we talked about some of the types. It's also important to define your goals. So maybe your goal is, I'm going to visit 10 new key contacts and centers of influence every week. It doesn't have to be huge. It doesn't have to be 100. It doesn't have to be 500. Just set your goals and outcomes. I'm going to set 10. This is what I'm going to say when I get there. Here's what I'm targeting in this geography based on where I'm looking to grow. And here's what I'm going to say when I get there. Now, the other thing is that you have to plan out a multi-touch on your calendar. So say you're starting fresh and doing this for July, and you're going to do 10 contacts a week or 40 this month. You're out there, you've got your introductory spiel, you're ready to go. Well, what's next? Is it next month, the month after? What are you going to do on touch 2, on touch 3, on touch 4? Are you going to keep adding next month, new and existing? And how are you going to manage that time? And blocking it on your calendar. I rest assured, if you do not block community marketing or key contact marketing on your calendar, it's unlikely to happen, especially when you're independent, right? Nobody's there over your shoulder. Like, did you do those key contacts? Did you visit those providers? So it takes some self-discipline to do it. It doesn't take a lot of money. So you just have to be willing to do it and have a plan of attack before you jump in. Now, identifying key contacts. So like I said, it can be doctor's offices, it could be hospital systems, it could be carrier partners. So just putting your name out there. It could be going to broker trainings like this one so you can network and meet people and show your engagement and interest for referrals and leads. It can be your existing clients. It can be centers of influence, so senior centers and mobile home parks, all those kinds of things. So identifying that and mapping out your list is a good first step. Some of you, it's intuitive, you've been doing this. For others, not so much, right? And so just identifying this list, and you don't have to go grand slam. You can go first base, right? So let me grab a few of these and get started, get my feet wet. The key that I have noticed with community marketing in general is that it's not instant gratification. And so many agents, unfortunately, want instant gratification. I went in there and I didn't get any leads today. I went in there and they didn't want to give me anything. Well, it might take you 5 or 6 touches to gain something from there. Now, once you've solidified those and they've become consistent referrals, then that relationship changes and it's a little bit something different. But preliminarily, you can't expect a lot. So the activity is the success. I did it. I met them. I had a good rapport. I built a friendship. I'm ready to handle the next step. The other thing you need to do is prepare, right? So again, all these centers of influence are getting visited by lots of yous, right? People coming in and peddling their product, whether it's Medicare or something else. Some of these doctors' offices and centers of influence, they're seeing people all day long. And they're just tired of it. Like, back off and give me some space. So why should they choose you? What makes you special? You've got to have that in your first minute pitch. Here's what I'm bringing to the table. Hey, my name's Erin Ackenheil. I've brought a lot of patients to your office in, through the Medicare program. I help people enroll in this space. I know sometimes the seniors that you work with can take a lot of time. If you ever have a question or need help, I'm here to support you. Not, I want your referrals, not, I want to put my flyers in your office. Just, how can I help? What do you need? What would be helpful? What kind of education are you looking for in your office? oh, by the way, here's a cup of coffee and a cookie or some pens or some notepads or whatever based on what they've shared with you. So going in, trying to get to know them, showing how you're special, but really understanding what do they need and listening and fulfilling that promise, that's going to distinguish you from 90% of the people out there. The other big thing in terms of preparation is your script, right? So I'm constantly telling people this. You can't just go wing it, right? Now, maybe you've got the gift of gab and you can, but for most of us, you've really got to get in there and be prepared beforehand. So what am I going to say? What's my point? What am I trying to do on touch number one? Maybe I'm going to go in with a leave behind about bonus benefits that people can take advantage of. Maybe I'm going to go in with a leave behind of key contact phone numbers that would be important to them. Maybe I'm going to go in with some definitions of frequently asked questions of Medicare patients, just so that they have something with my name on it that shows how helpful I am. So it's really important to prepare and know what you're going to talk about and practice it. I highly recommend practicing in front of a mirror, or you can videotape yourself. It's so easy these days to do anything that you want to do. Really, really important. I don't recommend winging it. So really important to be prepared. Now we have a question coming through. It says, as someone new to the broker world, what should I expect in my first interaction with the doctor's offices? What objections and kind of tactics should I use to overcome these? And do doctors embrace and expect this process? So this is a three-parter, and it leads me to, I'm going to take us to touch number one. So we talked about calendaring the activity and multi-touch, but let's talk about touch number one. So you're new. How do you get out there? So what you're going to experience when you visit doctors, some will embrace you and be excited to see you. Some will not, right? Some have said, like, we've had so many people in and out of here. We really don't want you to come in here. We don't allow anything to be posted. And it could feel kind of like a negative experience. Sometimes they're very open to it. Like, oh, you're here. Did you bring my coffee? Like, where's my notepad? That kind of thing. And both of those extremes don't necessarily deliver what you want, because what you're trying to do is build a relationship and a friendship with that office staff in the doctor's office or the center of influence or wherever you are. So I recommend for a first touch, just becoming friends. You know, hey, we're dating. Let's do this dance. Let's take it slow. Here's a business card. My name is Erin. This is who I am. Here's a little goodie. I brought cookies today. I brought some muffins. I brought you coffee, whatever is easy and most convenient for you. It doesn't have to be fancy. Just a nice little touch, a little sweet, probably individually wrapped these days with your business card. Hey, I just wanted to introduce myself. This is your 1 minute elevator speech, because you're only going to get a chance once to make that first impression. You know, my name is Erin. I work in the Medicare space. I help seniors navigate the Medicare A, B, C's, and D's. I've noticed that you have a lot of senior clients in your practice, and I just wanted to offer my services and be here to help and get to know you, because I figure we're working with the same people and I want to be a support system for you. Understand their needs. You know, do you see a lot of senior patients? Let me get to know more about your office. I've got a lot of patients that are looking for new doctors. They're coming from systems. Can you tell me a little bit about your practice and if you're looking to grow? Everybody likes to talk about themselves. Just like when you meet somebody for the first time in a dating situation, you're just dating these offices and you're going in there and you're probing to understand what they need and what's important to them to help them in their practice. When you help people get what they need, they tend to help you get what you need. So, David, you should ask, what do I do in touch number two, right? So you're just nurturing this friendship and relationship. You'll notice my strategy isn't to ask for things right out of the gates. And again, it can be easy to get a little bit impatient, right? Because you want to grow your business, you want to gain referrals, and you want to get enrollments. And so a lot of times people lose their patience, right? And that's not what's going to happen in touch one or two. If it does, amazing, right? But that would be the exception versus the rule. So the second time you go in, again, maybe you're bringing them another treat. This time it's, remember me, I was here last month. I'm a consistent person in the Medicare space. I'm not going away. This is what I do. I remember you, by the way. I remember your name is Susan and you have 2 kids, and gosh, it's summertime, and how are you managing going into the office with the 2 kids? You're building that relationship because you remember and you care about that person. You're building a friendship. You're building trust. You're leaving any relevant leave behinds. Did they give you some tickler information the last time you were there? Gosh, we could really use those frequently asked questions because we get questions and we just don't know how to address it. Here's the top 10 most frequently asked questions by Medicare beneficiaries. By the way, it's branded with my broker office on here. Here, keep this for all the staff so that you guys feel comfortable answering those questions. If there are any wins, like they've given you a referral, celebrate those wins. Or if you've enrolled somebody and given them that office as their primary care doctor or something else that you can celebrate that win, and be always sure to tell them what's to come. Hey, I'll be back next month. Open enrollment is approaching. You may end up getting more questions than usual. Let me help with that. So by touch number 3, maybe you've earned your first ask. Maybe you have, maybe you haven't, right? Only you will know. You'll have that comfort, right? You know, gosh, are we building a friendship still, or are we ready to ask for the first date? Like, has it gotten to that point? Can we do this dance? Have you earned this first ask? A relevant leave behind? Maybe it is time to put some brochures about your brokerage, or about meetings that you're having, or seminars that are coming up, or Medicare 101s. Is it time? If it's a doctor's office or a center of influence, it doesn't matter. Would they benefit from an in-service? An in-service meaning any topic they want to dive deep on. Gosh, Rotarians, do you want me to do an A, B, C's, and D's presentation for you? Gee, doctor's office, do you want me to work and explain Medicare Advantage and why it's beneficial for your patients? What would they like in the form of in-service? And then you prepare it, book it, and schedule it. But it takes time. Those kind of meetings can be like a lunch and learn or an evening. It could be an hour where you're going to meet with them, but you're solidifying that relationship. You're showing your value. You're showing your knowledge, and you're creating a situation where you can take referrals. Do they need anything else? Again, probing to understand, and of course, celebrating wins. And again, what's coming? Open enrollment's around the corner. Touch number 4, building your relationship. More leave behinds, flyers. Do they need anything else? So celebrate wins. Open enrollment is here. So you're taking them down the path of what you're doing all year long. It's pre-open enrollment. It's open enrollment. It's post-open enrollment. It's OEP. What is OEP? These doctors' offices and centers of influence aren't going to know what these things are, but you do. And you can bring that expertise to them, but don't pile it up on them. Build a relationship, right? If you're in your relationship and you're doing all the talking, nobody likes a relationship like that, right? You'd break up, right? And so you have to remember that it's a two-way street. You're building a friendship and a relationship with them. You're providing them information, but you're just as interested in them and what they have to say and what their needs are. Now, it doesn't stop on 4 touch. What you're going to find is that you've got to keep nurturing and planting the seeds with new offices, new clubs, new centers of influence. You've got to keep sowing the seeds out there and doing that and nurturing the relationship until it grows. Once you get going, there are going to be some what I call super referrers. It's good to be in touch with them more frequently, talking to them. What do they need? How can you help? Keeping track of the details is super important. In our CRM tool, for instance, you can track all the referrals that anybody's given you from a center of influence or a client. So you'll know, gosh, Erin Ackenheil's a super referrer. She sent 15 people my way this year. Wow, I want to give her a big thank you. I know that Dr. Jones's office has sent us several referrals. I want to be in touch and be grateful and thankful for that. It doesn't have to be a big gift. It could just be a thank you card. In fact, it probably can't be based on all the compliance rules. So a thank you note is good enough. People appreciate being appreciated and you being in touch and being consistent with them. Be grateful, express gratitude. Not everything is going to be a grand slam, home run. You have to be willing to go to first base, to get a bump once in a while, just a little bit nurturing to play the long game of where you want to go. You're just adding more and more to the mix. It's going to be important that you become really strong at your 1-minute entry statements, and ultimately you're leading to what is an in-service dynamo. So you can provide information on a variety of topics to train various audiences, whether that's the Rotarians or the physician office in service. You're going to help them grow, and in turn, they're going to help you grow. So here is my shameless commercial. I want to thank you all. I am trying to grow my YouTube subscriber base. And so my goal for this year is to get to 1,000 subscribers. So here's one of my personal goals. And you can help me. If you're a YouTube person or you want to be, you can log into YouTube, type in Black Point Insurance. I should pop up there and hit the subscribe button. When you help me grow, it helps me to be able to develop more and more content to bring out to all of you. So that's one way you can help me. And I hope that you found this information helpful. I want to thank all of you. I tried to answer the questions as they came up throughout. I think I got most of them. So I just want to thank everybody for your time and attention today. And if you need more information, you can contact us at blackpointinsurance.com. If you subscribe to me on the YouTube channel, you'll never miss a training, a Medicare Minute, or anything else in the Medicare Power Hour or the various content that we provide. So thank you, everybody. Have an amazing day. Thumbs up out there.